Well, thank you. Nice to be here, especially being bookended between the lovely Isabel and the beautiful Louisa, two of our wonderful PhD students from Sydney Uni, and it's great to work with them in the Mekong Livestock Research Group. And we're going to unpack a little bit of the bigger stuff that Isabel introduced, sort of big picture, and focus a little bit more on, as we go, on the village level and farmer level, and then through this talk, which is about infectious disease, and the next talk, which is really about parasite control, move on to Louisa's talk, which is about the next step, which was hopefully managing reproduction. So, yeah, I'll talk a little bit about regional food security and some of the research that we've done on infectious diseases. Essentially, the conclusion is quite strong. Keith mentioned in his talk, the evidence is really strong that vaccination has a big cost benefit, both at the individual farmer level, village level, district level, and in the national level. That's the data we're going to have a quick look at. But vaccination we can't depend on, and we know that we really have to change practices at the village level, by improved understanding, so that people actually have the knowledge. It's the knowledge-based interventions, not the technical interventions, that are going to make the whole disease control position sustainable in the long run, especially in a situation where we are, where you've got massive movements, 100,000 animals coming through Thailand, and 1 million animals going up into China, and really basic husbandry and lack of husbandry skills. And a village veterinary worker and village animal health worker network set up to try and encourage the use of HS vaccination to stop animals dying, but they've developed a new model, which is making money out of treating animals with antibiotics, FMD, which they don't need, of course. And that's one of the big costs of the disease. This is all about food security. Our work is really driven by the idea that we want to try and help harness essentially the 97% of farms in the world that are smallholders, that are, the 1.4 billion numbers of farmers who are really subsistence farmers with a small number of animals. Mainly those animals were for draft. Now they're converting to meat animals and changing their concept from being just a rice grower where they make no money to trying to exploit those animals now for trading and reinvest some of those profits back into other livestock enterprises. So we've had very good success in Cambodia with farmers having more cattle and developing native chicken enterprises, and in Laos, goats, so expanding their livestock enterprises to diversify their income and try and get them away from thinking that they're animal keepers to becoming animal producers, and that, therefore, trying to understand and manage the risks of production. So here we have a buffalo being fed stylo, a legume, 20% crude protein. It's fantastic. And those animals, when I went the first time to Laos in 2005, this farmer here was feeding that cow, and he was growing some forages. And that farm, he could buy a cow like that for $350, fatten it for 3-4 months, and he could sell it for up to $2,000. And his big question is, what do I have to do to stop this animal getting sick? And what was he doing? He's talking to the local village veterinary worker, and they're injecting it with antibiotics. It's not vaccinated. I'm going, wow, we need an animal health program here. Basic animal health program. They need to be focusing on disease prevention. And so we said, well, HS vaccine, foot and mouth disease vaccine, what else? Parasite control. When we look at that animal, in that village, every animal's got Fasciola gigantica. Up to half the calves are dying of Toxocara vitulorum. So there are some very basic, serious problems in there, but there's money to be made because of the demand, mainly from China and Vietnam, for red meat as they improve their economies. So how do you get people who've never thought about insurance, don't understand about risk, don't know the germ theory, to start thinking about risk management for livestock disease? It's a huge task. When we started this work in 2008, I thought, Now, 2018, the momentum is shifting. I can see an upward trajectory, and it's quite exciting that many people now are getting it, but it's taken a decade for them to really get to understand that what we're on about. Because up there in Laos, they've got the Hmong people. They like to fatten animals for bullfighting, and they bet on them. And some of that money is coming from America or Thailand to fund those animals. So they knew that you feed the animals, they get stronger, they can win a fight, and you can win money on them. So that was clearly a good place to start. So we got excited by that. And then down in Cambodia, people realised that you have all these animals now sitting around, and you can buy them fairly cheaply because nobody uses them for draft anymore, or they're almost gone. And but what are they fed on? Rice straw for much of the year. Can you fatten an animal on rice straw? Not really. So they're poor condition. They're mostly condition score 1, 1.5, and they're vulnerable to infectious disease and foot and mouth disease and endemic. We had a big outbreak through there, 2011-12, petered off, and every 7 years or so we get another big outbreak, and we've got another big one now as there's a wild type vaccination with the current strains going through, and then those animals have some immunity and the disease dies down, and bang, it comes back again, and with different serotypes. It's been a repeated pattern in this area for a long time, this sort of 7-year cycle. As animals move out, we know there's about 15-20% turnover every year of animals out of the villages. So it's no wonder that you're increasing the naive population annually. Now, one of the things we did when we first started, we said, right, we're going to have project villages. We're going to go in and vaccinate all those animals in the project villages. However, lost in translation in Laos, northern Laos, was that we're talking about high intervention villages, we're going to vaccinate everything, and low intervention villages, we're also going to vaccinate everything, because we're looking at other things. We're not looking at we didn't want animals to get FMD, but they got it wrong, and they vaccinated half the village. So we got this village here fully vaccinated, and this village here, half the animals vaccinated, and the surrounding villages, they all got FMD. We were lucky. We vaccinated them about a month before the FMD outbreak came through, and you can see 60-70% of the animals in the neighbouring villages got FMD. 8% died. They're mostly calves. Probably got myocarditis. So we saw a powerful evidence of the power of vaccination if you get it in. So we explored that case study by trying to put some to convince there's a lot of cynicism about this, the power of vaccine and the cost of FMD. So we put some numbers on it, and we estimated that the financial losses were, just under $2 per cow or buffalo in a fully vaccinated village versus up to $52 to $70 in an unvaccinated village. And so we did that based on the value of animals before they got the disease and the value of animals after they got the disease, and the cost of if you fed them and the cost of treatments and things like that. So then our colleague Jim came along and decided to do a PhD on this area in Cambodia, and he put up this nice diagram. And at that time we had a lot of animals, say a draft animal might get sick, it can't work for FMD, so you might have to hire it. You might have to hire the animal and hire the labour to. So he developed a nice little scenario tree for evaluating the cost of FMD there, and assessed the financial impact. And this is the post loss varied from 54% up to 92%, for example, if a bullock got FMD and was unable to work, or there was a mortality. So he did some partial budget analysis and found that the value of vaccination was $31.48 per animal if they're vaccinated twice a year. Very strongly positive incentive for biannual vaccination. So then we did the same thing in Laos with a different PhD student, and we found the same thing. We found the high cost of FMD, as we'd already established in a case study, that was at the village level you know, $30 per animal, nationally estimated between 13 and 100 million. That was a Monte Carlo simulation, so it very much depended on how much underreporting of FMD. The 13 is related to how much we knew about, but we knew we were getting very, very high levels of underreporting, meaning there's lots of disease out there that we didn't know about. So that if that figure is correct, we're able to say to policymakers, that's about 12% of the farm gate value of large ruminants in the country every time there's a big FMD outbreak that goes through the country. Once you start talking those figures, they start to listen. We did the similar thing with a financial impact survey questionnaire of 310 farmers, and this is we included this the cost of the treatment with antibiotics there, and we found again what I've already mentioned there, the high cost of the disease, and the partial budget analysis showing strongly positive if you vaccinate twice a year. So we've done a number of studies now that just continually find the same story. So with that success of the FISC technique, we thought, let's have a look at, we actually got a report, there's foot and mouth disease out in this province in Cambodia. But when we went out there, we sent a student out there, it was actually hemorrhagic septicemia. So we said, let's do the same thing, financial impact survey questionnaire. And of course, this is a very serious disease, of course. And of course, the parameters are, do the animals die, what treatment's given, the draft replacement, the lost income, the secondary employment, all those things are factored into the direct costs and indirect costs equations of the financial analysis. A loss of about 66% of pre-HS values for animals that were affected and recovered. And so there's a massive and significant benefit of biennial HS vaccination for hemorrhagic septicemia. Again, so, and it takes out, if you vaccinate for both, it takes out the problem that there's a misdiagnosis. The only problem is that these are animals that do respond to antibiotic treatment. So we really need to train the village veterinary worker to distinguish between the two diseases clearly and learn that these are animals, you can treat them with antibiotics, but it's a waste of money treating them foot and mouth disease with antibiotics, and it costs unnecessarily. Now, ever since I've been going up there, they've been telling me about blackleg being a serious disease in a few places, and I never saw it. Now, blackleg in my country is a death sentence, and animals don't recover. But in the tropical areas, they talk about, oh yeah, blackleg outbreak, the animals take 2 weeks to die, and only about a portion of them, maybe a third of them die. And I thought, wow, this is a different disease. So in our project site last year in Laos, we actually had an outbreak. These animals fully vaccinated of FMD and HS, and then we had a whole pile get sick. So we had to get in there quickly and remedy the situation. So we went in there, and it was just after some rain. There'd been some flooding. The animals were febrile. They had swellings and crepitus. You can see the swelling here behind the elbow, and some of them died. There's only 25% buffalo, 3% of cattle, and there's a lot of recovery, especially with antibiotic treatment. So we did the direct costs on that village and found that it was about, almost just under $1,000 affected household. 37% of annual household income. Over like 122% of the sale from the sale of large ruminants if they got that disease. So again, we found partial budget analysis a huge benefit. If there's only an outbreak once every 20 years, and in fact it was almost 20 years to the day when this outbreak occurred, that blackleg reappeared. Nobody told us there'd been blackleg there 20 years earlier, but they'd forgotten. But clearly, now Zetas donated some vaccine from Australia, so we went straight in and vaccinated them all, and there's been no problem since, so we'll see how it goes. So there's a disease. We've tried to publish this paper, and we've sent it off to a series of journals, and nobody knows anything about this disease. There's nothing really published, and so they say we haven't got any reviewers. So if there's anybody out there who'd like to volunteer who's had this experience, it's mainly in countries where they're occurring in countries where there's there's not strong science, so they are nervous about reviewing the paper, I think. Anyway, so what do we conclude from all this? Well, these are socioeconomic studies on infectious diseases. They're paradigm shifts. Well, I worked in the Philippines in 98, 99 in the FMD eradication. At the end of that, the economic analysis said that FMD is a disease of trade and is only of benefit to commercial producers. But I walked into households where they just lost all their pigs. That's half the income that they were going to make that year from that pig, that 2 litres a year. They make more out of that litter of pigs than they do if they work for the government. This is massive economic loss. I wished we'd written it up back then. And these people are devastated. This is a serious disease, FMD. So we've put that to bed now, and it's a disease, serious disease of smallholders. So if you're putting what we've identified in all this work, I suppose, some of the key findings that there's huge knowledge gaps of smallholders, traders, extension services that need to be filled here. It's a knowledge-based process. There's a problem of limited access to routine vaccination, except most governments have a program for HS vaccine. But what's driving FMD vaccine, and occasionally blackleg? There's governments try to... Have I done me 10 time?
Yeah.
I'll finish, right. And I'll just take up your question time because you can ask me questions on the next.
Mm-hmm.
So, I'm going the wrong way, sorry. Righto. So we have a website that Isabel mentioned, and lots of blogs and publications, etc., on that about all this work. So I thank you for our past, present, future collaborators. Just my final word. Australia helped eradicate FMD from Indonesia and the Philippines. The role of vaccination in the Philippines is not as clear as it was because it's pigs and vaccine doesn't work as well, but certainly these things. What have we got in Southeast Asia and many other parts of the world? How many of those boxes have we ticked? That's the challenge, isn't it? So it's simple. We know what to do. The tools are there, but it's much more complex than that because it's massive learning required by the people most affected. Okay, thank you for that.